Morning breaking over Milan. By the time people woke up here, normal life had been suspended. After nearly 6,000 cases of COVID-19 and more than 300 deaths, in the early hours the Italian Prime Minister announced drastic limits on people's lives.
Noi vogliamo garantire la salute dei cittadini.
We want to protect the health of all citizens. We are aware that this will create unease and that these measures will be a sacrifice, big and small. But this is the time to be responsible.
16 million people are now living under strict conditions. The entire region of Lombardy, home to the financial capital Milan, is under lockdown. But so are more than a dozen provinces and Venice. You can't enter or leave these red zones without an exceptional reason. Gatherings like weddings and funerals are suspended. Restaurants and cafes can open till 6 p.m, but must keep customers 1 metre apart. Unfortunately, many people slipped out of the region before the shutters came down. News of the lockdown was leaked last night, giving people the chance to flee south. People are being urged to stay put and stay at home. But Sophie Bevan, whose family lives not far from Milan, says some are ignoring the rules and no one's really enforcing them.
People are still going on trips, they're still going down the supermarkets. Luckily, as of this weekend, they've closed all the shopping centres. The shopping centres are now closed every weekend. They're open during the week, but they're closed every weekend. But you'll get groups of kids who have nothing to do at home, who will take a bus, because the buses are still running, and go down to the local shopping centres and hang out, as if there were nothing wrong. And people just don't appreciate the seriousness of it.
Perhaps to ram it home, the Italian government has released these pictures of a woman in her 60s with coronavirus being flown by military helicopter to a Lombardy hospital. Here we've not seen anything like the spread of the virus in Italy. 273 people in the UK now have COVID-19. The government hasn't reached for so-called social distancing measures yet, but it is introducing emergency legislation to protect the jobs of volunteers like the St John Ambulance, so they can stop work for 4 weeks to help the NHS.
We have around 10,000 committed volunteers who week in, week out help out in their communities, and we're talking about what role they could play going forwards. Receiving paid time off work to volunteer for us would be a new step, but it's something that we will explore with government because we want to play the fullest part possible in supporting the nation at our time of need.
Shoppers emptying shelves have forced 3 stores into rationing. Tesco and Waitrose online restricting sales of some antibacterial wipes, Asda some hand sanitizer. The Prime Minister said people don't need to stock up.
We've had no advice from the scientific advisors or the medical officer that there's any need for people to buy stuff in. If you think you've got symptoms, then the best thing to do, as you know, is to stay at home, contact the NHS. And yes, absolutely, we will make sure that we give the NHS all the support, all the investment it needs to cope with this crisis.
In the US, nearly 500 people in 32 states have tested positive for the coronavirus. 19 have died. Today, Democratic presidential candidate Bernie Sanders said campaign rallies could have to be cancelled. But in China, the number of new infections is falling rapidly every day. 57,000 people have recovered from the disease there.
We are very looking forward to going home.
Here, 32 people were also on the way home after their 2-week quarantine on the Wirral. A precaution, but we may see more preventative measures in the coming weeks.
Well, earlier I spoke to Dr. Rifat Atun, Professor of Global Health Systems at Harvard University, and I began by asking him whether he thought the UK government should be acting more aggressively in dealing with the outbreak.
There's a very fine balance between being highly alarmist but also having delayed action. What's important is that the government or the relevant authorities regularly monitor with strong surveillance system exactly what's going on and take action. But certainly one can take many actions, for example, reducing all unnecessary travel, reducing unnecessary non-essential domestic travel, avoiding large crowded meetings, this will certainly help reduce the peak in terms of the number of cases, but also delay the epidemic to give us more time to prepare and to react.
So when you look at the fact that Italy has now locked down the entire region of Lombardy, have governments around the world got to think the unthinkable with this disease? I mean, are we going to see at some point in the future London being locked down with a population, Greater London's got a population of 9 million. Is that possible?
If the numbers continue to rise, that is going to be one way of containing or delaying this epidemic.
When you look at how differently countries around the world are handling this, I'm thinking about, for example, Singapore had its first confirmed case on January the 23rd. The UK didn't announce its first confirmed case until over a week later, yet now we've got 273 cases, they've got 150. Obviously different population sizes, but is there a different approach being adopted that the UK could learn from?
Singapore had good experience from the SARS outbreak in the past, so they were able to act decisively and quickly, and they had systems in place to ensure that the policies were cascaded very rapidly. They were able to trace contacts. With the UK being a much larger government and a much larger country, sometimes the policies are more difficult to implement.
So if you were advising Boris Johnson, Prime Minister Boris Johnson, right now, what would you be advising him to do this week to get a grip on this situation so we don't see what's happened in Italy?
What's important in situations like this is that the authorities have full trust of the population. So transparency, regular updates on the situation is critical. Communication is very important. And rather than delaying action, one would have to take certain decisions, maybe in some pockets, as Italy did early on in Veneto and Lombardy division before the lockdown, maybe close off some areas and maybe ban large meetings because we really need to reduce transmission and delay the epidemic so that we have enough time to respond. Otherwise, the health system will be overwhelmed.
Rifat Hatun, thank you very much.
Thank you.